So hello, my name's Adrian Richards. I'm a consultant plastic and cosmetic surgeon, and today I'm going to be talking about prominent ear correction, which is also known by other terms like pinoplasty, otoplasty, prominent ear setting back. So it's got a lot of names, but I'm going to call it prominent ear correction. Okay, so who would benefit from surgery? Well, essentially someone who's got slightly sticky out ears. Normally the ears are normally in a vertical diameter, so the normal vertical height. The problem is that the fold here just hasn't really formed normally, and this is called the antihelical fold. So the helix is the rim of the ear, the antihelix is the fold here, and normally that just really hasn't formed, and the ear is outwards. And it can be outwards in the upper portion like that, or it can be outwards the whole way along. So it just really depends where the fold is not properly formed. Okay, now if you have other abnormalities of the ear, and these are quite common, you can have extra earbuds in front of your ear here. The ear could, rather than just be prominent, could have unusual cartilages, unusual sort of ripples in it. You can get abnormalities with the earlobe. The ear can be small, or in fact stuck to the head and doesn't separate normally from the head. And you probably need to see a plastic surgeon really to discuss those, but particular issues. Today I'm really going to concentrate on the most common abnormality, which is prominence. Okay, so prominent ears, if you do have them and you do have children, it's important to know that they can be corrected early at birth. So if you can get them at birth and get a little splint called an ear buddy, which you place inside the ear, that can hold the cartilage back, and while it's still very sort of malleable and flexible, the ear cartilage can be held back, and that holds it back, helps reform the fold, and most people won't need that surgery later in life. So prominent ears do tend to run in families, so if you are having children, do consider that option. Okay, so but if you have got prominent ears, what can you do about it? Well, the normal age to correct them is normally about 5, so that's normally just before children go to secondary school, when they're likely to be teased, and are concerned about it. So 5 is a good age to do it, and then any time through the teenage years is fine. Normally we do like to wait till the child actually decides that they would like to have the ears corrected, because it's much easier to perform surgery if the child has sort of buy-in and actually sort of volunteers for the operation. But prominent ears can be corrected at any time. The oldest patient I've treated is 70, a gentleman who decided to have his prominent ears treated late in life. So they can be treated any time, and basically the technique is very similar. Okay, so all techniques have some similarities and some differences. The incision to access the cartilage is nearly always from behind. Okay, so the ear is basically a cartilage sandwich. So it's cartilage, which is gristle, so it's just like normal white gristle, a sheet of it, and on either side there's skin. Okay, so it's the cartilage that's the problem, it's not the skin. So just by removing and tightening the skin in the back won't cure the problem. Okay, so the normal technique is scar in the back. Operation can be performed under general anaesthetic, or twilight, or local anaesthetic. So it's really your decision as to which of those you'd prefer. Incisions made in the back of the ear, not much skin's removed, because as I said before, it's not the skin that's causing the problem. And then normally stitches are used to recreate the fold. So the ear is stitched backwards to create the fold, and sometimes actually set back slightly against the skull. So these are different suture techniques which you could discuss with your plastic surgeon. Each surgeon does them slightly differently, but generally you use permanent stitches which sort of become incorporated in the ear. That's the technique I prefer, which is really all done from the back. There are older techniques which actually divide the cartilage, so although the incision's in the back, the gristle's divided, and then the cartilage is scored, so that the surgeon makes marks on the front to weaken the front of the cartilage. We tend to move away a little bit from those techniques because they can create a slightly unnatural looking ear. Although the ear is back, it doesn't look absolutely normal, and also the risk of complications is much higher with the scoring techniques because the cartilage is being divided and there's a potential space for blood to collect in the front of the ear, which can give sort of cauliflower ears, like the rugby players get. So there's been a real trend now to using a technique just really from the back with permanent stitches used to hold the ear backwards. And so I'm going to talk in another video a little bit about recovery, bandages, and those sort of issues from prominent ear correction. So I hope this video has been informative. If you would like any more information about prominent ear correction, or like to arrange a complimentary consultation with one of our surgeons who specialise particularly in ears, please do so by either ringing us on 01844 214 362 or email us at the website, which is Aurora, that's AURORA-clinics.co.uk. Thanks for taking the time to watch the video, and we look forward to seeing you soon.